At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend breast thermography and early detection on Wednesday, September 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. This is Dr. Tom, and I've got another great program. But you know what? In the world of modern technology, and you know that I all start teaching all over the world and different parts of the country. Well, I'm broadcasting to you from out of the area today. I'm actually down in Orlando at the Florida Chiropractic Association National Convention, and it's people from a lot of different professional platforms, not only chiropractors, but medical physicians who are interested in functional medicine protocols and so forth. And it's been a great 4 days, 3,000 plus docs and about 400 vendors in different areas. I learned a lot. This is one of the first times. I just had a couple board meetings to attend, but I really didn't have to do any heavy lifting, if you will. Had the pleasure of meeting some very amazing people I had never met before, and I'll talk to you just a little bit about them later on as we get into the program. But what we want to cover over the next few weeks is a misunderstanding and a clarification of different types of breast cancer, the real incidence. Are things getting worse? Are things getting better? Are they affecting everyone across the board? And when I say everyone, guys, you're included too. Men, you get breast cancer. And, there's some journals out there that'll tell you that it's as low as 1% of the general population, but or actually all breast cancers. In some literature, if you get into some of the professional journal publications like Nature and PubMed, Townsend Letter, and so forth, they say that it might actually be higher, up to about 5%. So we're going to talk about what that really means and kind of move that forward and tell you what the risk factors are and, that sort of thing, because you really need to know. As you know, we have a thermography group as part of the Roselle Center for Healing, and it's actually a separate company, but we have an in-house presentation, and we have a mobile service that goes out to different doctors' offices to take thermographic imaging. So let's start with that. Why would you think that thermography is important in the identification of breast cancer, but in virtually any type of pathology in the body? Well, it's simply this, and we're going to actually have somebody who's smarter than me on the program when it comes to this, Dareth Painter. And by the way, when I'm done with the program today, make sure you join me on Dr. Tom Roselle live stream. It's called Ageless Health live stream. So drtomroselle.com, drtomroselle.com. Right after the program, hit the link. It'll take you right into it. You get to see this crazy face here down in Florida. And, we're going to talk to you and continue the process and the discussion, if you will, on the subject that we're getting into right now. But in any of the platforms, our old podcasts, if you want to look at the live streams that we've done, go to drtomroselle.com and go straight up to the bar at the top. And if you go over to the right, you're going to see podcasts and live stream. Hit it. So we'll get to that soon. But let's get back into the subject just a little bit. And we'll start it out by saying prostate and breast cancers are both common cancers, and they're linked genetically. There's a genetic link between the two of them. The tissues of prostate and the tissues of breast are genetically similar. And so they have the same susceptibility that may be causing problems. And when we're talking about that, we're talking about the susceptible platform, your genome, your biological genome, your genetic association. And we're going to talk about BRCA markers, which most of you know, that's what we're talking about. and we'll go from there. Now, having said that, when somebody comes into our office, other than going through our thermography group to get an examination, and it shows up the heat signal, the inflammatory reaction that says there may be a presence of something that shouldn't be there, it doesn't diagnose the tumor. It diagnoses the support system, the blood supply, before it becomes the tumor, the cancer that's identifiable on mammography and so forth. And we'll get to that in much more detail as we go through. But here's the deal. When you diagnose any type of cancer, it all has the ability to metastasize. That means it's going to spread someplace else. Breast cancer is no different. Breast cancer can spread to any bone in the body, but most commonly, they go to the ribs, they go to the spine, they go to the pelvis, the arms, the legs. And, within the spine, you have the place where the ribs come off. That's called the thoracic spine. And it's the most common area is the rib area right next to the spinal area. So and that next piece is the low back, the lumbar spine, and the front, the sternum, your breastbone. All of these guys are very common areas of distribution or metastatic involvement in breast cancer. Kind of interesting, right? So you may not even have a lump or a bump. It may be one of these subtle things that expand into the system. And then by the time you start knowing that there may be something wrong in the primary site, the breast, and guys, this goes for you with prostate. Remember I said genetically is the same? So it's already in the bone. It's already in the ribs. It's already in the spine. It's already in the pelvis. And you have to go to a doc that understands that back pain may not be something that is just a out of position, which in my world I call spinal subluxation, or the osteopaths call in a lesion, a bone lesion. That just means the vertebrae, the spine, or the ribs are out of position, and that's causing irritation. But it could be something much more significant. So it could be in any of these areas. It could be within the spine, within the ribs, within, different bony structures. So when breast cancer spreads to the bones, it's called a secondary site, or commonly a metastasis. And so we have to be very careful in how we diagnose it. Symptoms are like, it feels like pain. Sometimes it feels like a broken bone, that, something, I didn't break anything. My God, I can't even touch it. And depends on the site of the disease. And that's what I really want you to understand. So as it goes into the bone, as these lesions go into the lymphatic system, and then they go to the bone, and you start seeing things like anemia. It's also known as something called myelofibrosis, a big name, right? But that's what it's called, and that's where it goes, and that's how it shows up. So if you get somebody with a blood count, meaning a red blood count that is low, you start thinking, is this just because they got a B12 problem and a folate problem? Or is it something deeper? Is it something that is coming from somewhere else? You have to be able to dig through the process and do the right testing to find out if that's what you're dealing with, or if it's something simple. So when a patient comes in and we deal with them and they have back pain, the history is very important. And we're going to ask them all kinds of questions that seem to be maybe not related. We'll talk about, temperature gradients and variants. Ladies, you call that your personal summers, when you go through perimenopause and menopause. Guys, by the way, don't get schmug. You do the same thing. You go through these irritability periods, and you seem to shift in peri when it comes to weather as well. So we're all kind of in that place, that menopause in women, and the perimenopause, or the perimenopause with guys is called andropause with you. So when we're talking about the potential of something going someplace else and going into the spine or the rib cage or the pelvis or even the upper thigh bones, it's, you have to be very careful of how you examine the complaint, not just say, well, take these things and, call me in the morning. Ovarian cancer, there's very specific markers, by the way, and that can be part of the puzzle. You run something called a CA-125, and then you would do some other things. But thermographic imaging will show an increase of heat signal. So let's say, now I'm going to carry this through for you when it comes to thermography. Remember I said thermography doesn't diagnose the tumor or the lesion. It diagnoses the increased heat signal. So this is how it works. So when you have a patient that comes in and says, I've got back pain, and we'll say, well, where is it? How is it? What type of pain is it? Grade the pain for me. How did it show up? Was there anything that you did that may have triggered it, caused it? When was the very first time? So we'll do that. And then we'll start talking about, depends on the patient age. The most common age for breast cancer, by the way, is 61 years old, ladies. So, keep that in mind. All these mammographies that they've been selling you for before that, they're not really necessary. They shouldn't have been done anyway, in my opinion, because, as we said, you take soft breast tissue, you're crushing it by about 45 pounds, and then you're going to radiate it. That all by itself is potential cancer triggering mechanisms. Now, having said that, right? So when you go through all this history and these diagnostics that we do and muscle response testing and so forth, often I will ask Dareth Painter, who will be our guest, repetitively over the next few weeks, take a picture for me. I want to see what's going on at this area. So I'll have her take a picture of the spine, or I'll have her take a picture of the pelvis. And if I see a consolidated hot area, as well as a consolidated hot area of the breast, I know I got a problem. Next step, we're going to do some ultrasound, but if it's someplace other than just within the breast tissue, I may at that point order MRI, or a CAT scan to find out what's going on and see if it's in other areas or what it is, but we'll also run the cancer markers. So we have to understand that this is a multidimensional piece. And if you get it early, if you understand that it just doesn't happen at a click of a finger, if you will, that it's been building over time. It's like diathermy, as Dareth will tell you when she comes on the program, will identify a potential beginning of breast cancer anywhere from 3 to 8 years, 3 to 8 years before the cancer shows up. How does it do that? Well, breast cancers, like other cancers, need a blood supply. Blood supply portrays a heat signal. So if you begin to see this abnormal shift in the breast tissue of a heat signal, even though there's no palpatory lump or anything of that nature, even though the mammography comes back negative, even though that you may have had an ultrasound that didn't show anything, this increased vascular pattern begins to give you a head that says, I got a problem here. We've got to do something about it, right? So then you look at it, and generally what you do with a breast exam, she'll tell you, you do an initial examination, and then you follow one up in 3 months. And you see what the changes may or may not be. If there is a change, if there's more expansiveness of that heat signal, or if that heat signal gets more intense, you got to do something more diagnostically. And the most effective diagnostic tool is what? Is ultrasound and MRI together, magnetic resonance imaging, instead of the mammography. Mammography has a really big false positive, false negative rate. So wouldn't you like to have more on your team? And Mike, what do they do after mammography anyway? They send you for an ultrasound and an MRI. And we'll get into why, my opinion, if you have an opportunity, a choice, that you should never do a biopsy, because one of the things I'll lead with is that it can spread what's going on in there as it withdraws it through other healthy tissue, because it implants it, so to speak. Now, let's get back into this and let's really talk about what you need to know about this, because on the 11th, by the way, and put this date away and register as soon as you can. I almost forgot to tell you about that. On the 11th of September, coming up pretty rapidly. This summer's just kind of blowing by faster than I ever thought it possibly could. It's a Wednesday evening at 6 p.m. at the Roselle Center for Healing in Fairfax. What we're going to be doing is a night on thermographic imaging of breast cancer and why it's so important. And we're going to show you all kinds of pictures. We're going to talk to you about the different types of things. We're going to give you preventative steps that you can take to help yourself. We're going to talk about the different treatment options that are out there, not in our practice, but that are available to you. And we're going to talk to you about what really you need to know about what pain is actually saying to you. And in the majority of cases, that back pain is back pain. It's misalignment of the spine, it's postural imbalances, it's reflexive irritation, that sort of thing. And when it's not, this is what it looks like. So join us on the 11th. All you have to do to register, you can do one of two ways, one of three ways. Go to drtomroselle.com and register there, or simply go to rosellecare.com, register there, or you can do it the old-fashioned way, 703-698-7117. That's 703-698-7117. Now, in my house, as I said, under my roof, my wife will only do a thermographic imaging screen, and she does it on an annual basis because it's much more identifying, if you will. Now, does that mean that she would never, ever, ever do a mammography? Only if the thermogram and the other diagnostic things say there might be something here, we need to take another step, but not until that, because she knows as well as now that you do, that when you do multiple mammographies, you end up increasing your risk of breast cancer because of the radiation that soft, delicate tissue, your breast tissue, is taking. So we're going to set that aside just for a little bit. And when you remember that pain may have other sources depending on other things that you're ignoring. And when you look at starting, so why do we have so many cancers? And we're going to talk about that a little bit today in the live stream program. We're just going to follow directly after this, and you're going to come with me, right? Right after this, we're going to go into Dr. Tom Roselle, Ageless Health live stream. And we're going to talk about the why and where and so forth, and what the commonalities of these things are. Breast cancers will spread in a lot of different places, but bone is often the one where it goes to first. So first the lymph nodes, because that's how it gets to the bone. Then the bone is the second. And then, the commonality there is that these are lesions that get into the lymphatic system and go to the bone. So when it spreads to the bone, it's called metastasis. But is it already metastasized if it goes in the lymphatic system? The truth of it is yes. So let's do this. What happens? Let's play the what if game. What happens if you go in and you have radiation, and you go in and you have, all these things done to the bone that it's in, to the breast tissue itself, but it's in the lymphatic tissue? But there's nothing else finger pointing says out there. Is chemotherapeutics going to be the best place for you to go? Maybe not, because we know that even with that, sometimes, not sometimes, the percentage is high that over so many years, it comes back. So how did it come back if you got rid of it? So that's what we're going to talk about today. We're going to talk about that interesting balance as we go into the live stream of estrogens and progesterones. We're going to talk about those estrogenic platforms. We're going to talk a little bit of the link as it has to do with COVID and the exponential rise in all types of cancers, but particularly breast cancer, and why that's taking place. So don't forget to join me. We're going to have some finger pointing fun, if you will. And when I say that, I mean this. You don't know what you don't know until you know what you don't know. And I want to give you all the information that you can. So remember that you can make your own decisions about your health. That's the important piece. Remember what I've said repetitively over and over again? My job is to provoke you. Don't believe me. Don't believe anybody else. Do your own homework. It's Ageless Health. It's in your hands. Health is a do-it-yourself program. You're the one that has to make a difference. But bone metastasis has to have a forum in your own mind of how to identify and not worry. Okay, metastatic cancer of the bone comes from the breast. But why did it start there? Why is it most of the estrogen tags that go to different places? As I said, the common sites, the bones, right? but it has to go through the lymphatic system. Common site is what? The brain, but it has to go through the lymphatic system. Common site, the lungs, but it has to go through the lymphatic system. Common site, same thing. Liver has to go through where? The lymphatic system. So that's the transport system. You can't take the transport system away, because then you end up with other issues as well. It's like, back in the day, if you had breast cancer, they took the sentinel node out of your armpit and they stripped out 4, 5, 6 nodes. Then what happens? Your arm swells all the time. You got to wear a band to compress it to move the lymphatic system back to where it needs to go. So it's not okay. Metastatic breast cancer most commonly goes to the bone, and it could spread from the bone to a lot of different areas. But guys, remember, I'm talking to you as well. Why? Because the same lesions that develop in the breast, the triggering mechanism for that tissue, the estrogenic imbalances, most often are the same as the estrogenic imbalances that cause your prostate to break down and develop cancer and ultimately spread and go a lot of different places. And sometimes, all of us ignore it because, you start having some urinary problems and you say, well, I'm getting older. That's what happens, because you saw your father, your grandfather, and everybody else, all the male people around you have these urinary problems. Well, man, let me tell you something. It's not something that you should ignore, particularly when, in my world, I'm going to tell you there's a lot of different ways of handling this stuff, and you can virtually turn them around. It's important, it's critical that you have the tools, that you understand that you can do a whole lot about what's taking place, and you actually do what you need to do early enough to make a difference. Survival rate can be real high if you become proactive. Survival rate can be the best of the best as long as you know what you're dealing with. And my job is to give you the data. My job is to give you the information and make it happen. Listen, we're coming up, to kind of the tail end of the program. I want to remind you, join me on Ageless Health live stream with yours truly, Dr. Tom. And to do that, if you don't have me hooked into one of your social media platforms, simply go to drtomroselle.com. And it'll be a screen that'll pop up. You hit that button, you go right into the live stream, and we're good to go. We're going to continue this conversation a little differently. We're going to give you a couple things, but you get to see the face with the voice, and that's the most important thing. And that way you can see, you look at the eyes, you can see whether I'm serious about what I always am. Remember, I do this on an ongoing basis, on a continual basis, for one reason only. You deserve the data, but more importantly, I love you all. I'll see you next week. Have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend breast thermography and early detection on Wednesday, September 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.